You are welcome to Timboni Community Dispensary. This is our dispensary which was donated by the donors through Total Bay Hotel, and it has started by the community in Timboni and get funds from Total Bay Hotel through donors. You are all welcome, and here we have committee members and the staff. Some of our committee members are not here, and also even our sister in charge, she's not feeling well. By now, she's not here. But here, myself is Zainab Mohammed. I'm the treasurer of the project, and also I'm working the registration room. In my right, she is Esha Masito. She's working in the pharmacy room. Here is Mr. Joel Bayer. He's the chairman of the project since we have started in 1997. And in my left, it is Mr. James Kai. He's working in the lab. He's a lab technician. After Mr. James Kai is Mary Bayer. She's one of the committee member, and also she's a staff in the dispensary. She's an assistant nurse. She's working with our nurse in charge. When she's not in the clinic, she's the one who holds her office. Okay, now thank you very much. Now we shall go around. We shall start with a registration room. This is the registration room where I'm working with. And here it is a place where we register for the outpatient cards, and also we make an maternal child health clinic for the babies, and also we are taking weight for the antenatal care, pregnant women, and also it is the first place when everybody is coming, he or she has to report here and then to go to, then I can give her the direction to go where to. Also all the records in the dispensary we are keeping here. Like also we are selling mosquito nets to control malaria cases, also are sold here. There's some books for recording, and also we are collecting some money from the outpatients so that the money which they are paying for the charges of the treatment. Any inquiries passing here and then sent to the place where it is needed. Here is an examination room. Meet Mary Bayer, who is an assistant nurse. When nurse is not around, she's the one who holds the office, and everything is continuous the way it is in order. Now, this examination room, all cases are attended here and examined. Also referrals to lab, it is from here. And also some other cases which are to refer to General Hospital also are making here. And we have a cupboard, as you have seen. The cupboard also we get from the donors. And also we have the refrigerator. Also we receive from funds from Total Bay Hotel through the donors. We have a sterilizer. We have some different drugs we are getting from the Total Bay Hotel through the donors. Sometimes we need like something like autoclave or sterilizer. We request to the hotel, and then the hotel send the emails to the donors. We we purchase for the price in Mombasa Surgical Suppliers, and then they give us the price. We send to Total Bay Hotel. The Total Bay Hotel, if they get funds, they tell us, and then they make a check so that we send it to Mombasa, and the Mombasa supply to hotel, then hotel bring it to us, the equipments which we are needed. We are very much thankful for all donors who are passing their funds and donations through Total Bay Hotel, because we receive it in order and we are very happy with it. We don't get any problems. We just request it from our committee members. We decide we need this and this, and then we send them to order to hotel through our coordinator and community office, and then we receive the checks. We send to either to the chemist or either to the Mombasa Surgical, and then we receive the equipment. Like one time we request for the delivery equipments, dressing materials, all are here, and we make sure that we use it and keep it properly so that it can be safe for any time to use it. Also, we have a laboratory. We have a laboratory which we get a microscope from the Richard Fox in Total Bay Hotel. And so many funds we are receiving from John's family and the friends in their England church, and also many funds we are receiving from Richard Fox and his wife and their friends in their church in England. This is pharmacy. First, we have started this pharmacy as a Bamako initiative to sell some medicine without being treated from a doctor, just to say your problems, and then the pharmacia examine her or he. But now we are all cases are passing through the doctor or the nurse, and then Madam Asia give the medicine through the outpatient card, the drug which is written here, and then she's the one who give out the medicine. This is our pharmacy now. We have some drugs, and also we have some other drugs in the store. We are taking us from bin cards, reminders, and then it comes to the pharmacy. After finishing it, we take some others in the store.
When did the hospital start, the community dispensary start, and how has it developed over the years?
Now it is 4 years since we have started as a full dispensary, because before it was only, since 1997, it was only a Bamako initiative. We sell only medicine without any doctor or any nurse enroll. But since in 2004, we are starting as a full clinic. Up to now, we are a full dispensary.
How has the community dispensary benefited the local community within this area?
The local community, they benefit from the treatment, because we are doing some of the services. They are paying some a little amount of money, and other services we are offering to the community free. Like here, we have so many cases of UTI, which most people are very poor, they don't have money to pay. In the private clinics, like the UTI cases, they pay nearly 1,000 shillings, and they cannot afford, so they stay with that cases until it is a chronic. But when we have this project here, they come and explain to their problems to the in charge, and then they get treatment if they have money, if they don't have, but they are treated. And also we have some cases of infected people with HIV cases, which we refer them to Malindi District Hospital after they getting testing in CD4 counting and started some medicine of ARVs. Then they transfer back to Timboni. Here we treat them like some other people. They have a streptomycin injection. We inject them free because they have been given the streptomycin vials. And here we give them, we use our needles and syringe, and also we use our water for injection and swabs. We give them free treatment. And after that, if they have some other cases, like other people, they're using TB drugs, and they have some cases of scabbing or rashes, then they come here to report and we treat them free. Also, we are making the antenatal care, which most of them, sometimes they have anemia. We give also the anemia medicines free. So most of the people here, they like it and they come to have that services free. We are counseling them, like the children from primary school, we are making counseling free. Couple also, they come to have tests, and also we counsel them before they get married, and even if after they get married also they come for the counseling most of the time. People also, they are coming to buy like mosquito nets. They get them for 50 shillings. In all clinics, they have to go with the clinic card. Without a clinic card, you cannot buy a mosquito net. But here, if you have it, if you don't have, if you are a child or if you are an adult, a man or a woman, you are buying a mosquito net at 50 shillings without any questions.
What are the challenges that you face within the area?
Challenges we are facing, there are so many, but most of them, some other people, if we request some money from them, like sometimes they get treated for malaria, like for 250 or 300, because we are requesting for the lab test. They have some lab Widal test, and also they have some other times they have a BS or stool test, and also sometimes they get a VDRL test. After we request for them to pay some money, they say that this is free, and is the dispensary for the community, and yet we need some salaries from the dispensary, and we must sell some drugs. We must ask some funds from them, so that it is like a revolving fund. We are getting funds from them. We are buying medicine in the chemist in Malindi or sometimes in Mombasa, and also we are paying electricity bill, we are paying water bill, and we need some detergents for making a cleanup, and also sometimes we need a renovation like painting and other things. Also we are using money, and we have to have money. We cannot say all the money coming from the donors. It can't. It must be like a sharing, cost sharing. They pay a little, and we ask for some a little in the hotel, and then we contribute, we add together so that we still running our project. That can make us to sustain in our project. Otherwise, if we give them all the drugs free and we are not getting all the drugs free, then it can make us to fail in our project. That is one of the challenges. Another challenge is that we are being monitoring by district hospital, and all the time they have records. We have keep records at least on 4th of the first month of our first month. We have to send all the diagnosis report in Malindi district hospital. Financial reports, diagnosis reports, any equipment which we receive it, any funds from the donors, any funds from the government which we are receiving, we must make a report, and then we send it all, we compile all together, and then we send it to the district hospital. The services which we are doing, like monitoring child health, the clinic for the babies, antenatals, even the dressing also, we are counting, and we send the records to the district hospital. That is why they help us to support, instead of making a license from the Nairobi, and then they are supporting us like a community project under government hospital. That is one of the supporting. But for us, we find it is difficult, but we tried, because we are also getting supporting from the MOH through Malindi District Hospital. Like they offer us not to have a license. We use a license as a community dispensary, which we are under government hospital. And also another thing is that all cases which we are sending there, also they help the MOH in Malindi to send it to Nairobi, so that if any other help or any other equipment coming from Malindi District Hospital, we are being counted inside. Like the equipments I've shown you inside, delivery beds, standing drip, another bed there, they send it to us through our records which we are sending to them.